Thank you, Madam Chair. I would like to share with our participants the key achievements in the West Africa region through the West African Health Organization, ECOWAS, in the integration between agriculture, health, and nutrition for improving food and nutrition security. And in that framework, the promotion of the biodiversity is a central piece. Before that, I would like to make a remark after one concern from Rosanna regarding the collaboration between WAHO and the ECOWAS Commission for Agriculture, Environment, and Water Resources. We are working closely together, and last May 16 to 18, we have developed a joint action plan, which is over there, in collaboration with FAO and Biodiversity International, among other partners. The other issue is that the ECOWAS Commission for Agriculture is part of the regional economic community. ECOWAS is the regional economic community for the implementation of CAADP. Even if it's not perfect, we need to take this opportunity to strengthen it. I will skip the nutrition situation in West Africa, which is characterized by the double burden of malnutrition because stunting is very high and cardiovascular diseases, chronic disease in general, obesity, diabetes, cardiovascular disease are increasing as well. The situation of agriculture in West Africa is very difficult in this situation because we need to keep in mind the policy reforms in the 1990 by the Bretton Woods institutions, and up to now, resources for agriculture are very slight. Countries are affected by climate change effects and also by the global increase of food prices and a structural food insecurity due to a lack of access to foods. And this was highlighted during the last meeting of the Network for the Prevention of Food Crisis in West Africa in December 2010 in Accra. From different meetings in West Africa, I can say since 2006 to 2010, we recognize that no West African country provides 30% of the national budget to agriculture sector. Agriculture, health, and nutrition are still working separately. Agriculture sector represents at least 70% of our workforce and can contribute up to 60% of our GDP. And the livestock sector alone can contribute up to 40% to our GDP. This means that we need to invest in this sector, otherwise we will never see a sustainable development in the sub-region. However, it is still a challenge to build a strong collaborative pathway between agriculture and health and nutrition sectors, as we have discussed it at the ECOWAS Nutrition Forum in 2008. The report is over there. To ensure food and nutrition security, we need to take into consideration several issues. One is food availability, that is the supply side, food accessibility, that is the demand side, and also food stability for sustained access to foods. And the last point is food diversification. In terms of initiatives, WAHO and its partners are addressing the huge gap around food consumption, focusing on good quality, dietary quality and dietary diversity, for reducing the rates of undernutrition, overweight, and obesity, and also improving food and nutrition security in the sub-region. Achieving greater dietary diversity may not be expensive for households, as in the promotion of local and traditional foods, like green leafy vegetables, other nutrient-dense foods, unfortunately considered as low-status foods. Moreover, since poverty is such a limiting factor in household food consumption, our partnerships involve smallholder farmers networks, agriculture and health and nutrition policymakers. Smallholder farmers can produce and supply markets and at the same time promoting, preserving biodiversity of traditional food and also local knowledge. We have implemented several initiatives in coordination and harmonization and also partnership and advocacy, as said by the others. I can say that from 2006 to 2010, in collaboration with a variety of international and regional partners, as well as agriculture and nutrition officers in country, WAHO and partners support the integration of nutrition indicators in the early warning system data collection in West Africa, extended to some countries in Central Africa. But we are facing to a major technical constraints because we do not always know the composition of the local and traditional food we are producing. That's the reason why we are currently compiling existing information into a West African food composition database. Other important steps include advocacy, raising public awareness on food and nutrition, and building capacity of smallholders through the action plan of Abuja we have developed with the ECOWAS Commission of Agriculture. Last year, the first regional food compensation user database was finalized within a partnership between WAHO, FAO, Biodiversity International, and In Foods. We have some handouts over there. Partnership was broadened progressively. FAO, Biodiversity, and WAHO were basic leaders. Now we have brought civil society, especially the Network of Food Producers of West Africa, USAID, African Development Bank as financial institution, international NGOs, the ECOWAS Parliament. I used to attend several sessions to increase awareness on nutrition in food security of the Commission of Agriculture of the Parliament of ECOWAS. However, we are facing to several constraints in the framework of all these initiatives we are implementing. The first constraint is the negative effects of globalization in the food systems, the low investment in agriculture sector, integrating nutrition at regional and at country level, the coordination among partners, and this coordination was a recommendation of the 2008 ECOWAS Nutrition Forum I talked about earlier. And the last concern is the governance, more visibility in the way we are doing partnerships. In terms of challenges, we have two major challenges. Is to continue to strengthen the multi-sectoral, multidisciplinary, and comprehensive approach we are using up to now to integrate nutrition, food security, and health, agriculture, food security and nutrition. The second challenge is to mobilize resources for the implementation of this 5-year action plan we have developed in collaboration with the community-based organization affiliated to ROPA and research institutions. In conclusion, the need for a collaborative partnership between agriculture, health, and nutrition is increasingly being recognized in West Africa. During the first 4 years, a strong regional multidisciplinary and cross-sectoral partnership is being strengthening. The overreaching objective of this initiative is to ensure the effective promotion of the local food resources from West Africa ecosystems in households, with strategies and interventions against food insecurity, micronutrient deficiencies, and diet-related chronic diseases. Thank you very much.